Welcome guys, my name is Dr. Manuel Isang, and today I'm going to be talking about hypertension, 5 facts about it, and why it is known as the silent killer. Now what exactly is blood pressure? Blood pressure is actually the force that is exerted on the artery walls as blood is being pumped out of the heart. Why this is important is the higher that number is, the harder the heart has to work, and over time, I'm talking about weeks, months, and decades, the larger the heart becomes and the downstream effects of it, which can include things like heart attacks, heart failure, strokes, dementia, and many more. Now, what exactly is hypertension? Hypertension is having a systolic blood pressure, which is the top number that is higher than 120, and a diastolic blood pressure, the lower number, higher than 80. It becomes a lot more important once that number is higher than 140 or higher than 90. This is known as stage 2 hypertension. And the importance of this, once again, is it can lead to a lot of downstream effects, including strokes and heart attacks. The more that we know that now, the more that we can prevent those downstream effects from happening. Now, why exactly is hypertension important? It can lead to things such as strokes, heart attacks, heart failure, kidney failure to the point where you need dialysis, peripheral arterial disease, which is blockage in the arteries of the legs, the arms, the necks, and the eyes, which can lead to potentially blindness. Now, the reason that this is important is a lot of these conditions are associated with poorly controlled hypertension. If we can control the hypertension, we can potentially prevent or delay the onset of these events from occurring. Now, the biggest question is, why is hypertension known as a silent killer? Well, the biggest issue regarding this is the symptoms, or are the symptoms. Hypertension typically does not have any symptoms, and this is why it's known as a silent killer. It is not until someone has had a pretty bad event, such as a heart attack, such as a stroke, that they get diagnosed with hypertension. So it's extremely important for us to know that they have hypertension so we can prevent these events from happening. Now, I can see what you're thinking. If hypertension is known as a silent killer because there are no symptoms, then how exactly can I know that I have hypertension? Well, this is why it's extremely important to be vigilant regarding your health. It's important to see your primary medical provider at least once a year so that they can check on your blood pressure. In addition, they can check other lab works that can be associated with hypertension. Now, over 90% of hypertension is known as primary hypertension, meaning that there's no underlying factor to it. There are some risk factors such as being overweight, excess salt content, poor nutrition, lack of exercise that can be associated with primary hypertension. Now, this is compared to secondary hypertension, which is around 5% of the causes of hypertension. And secondary hypertension is hypertension that is due to something else, due to a secondary cause. Things like blockage in the kidney arteries or renal artery stenosis, things like fibromuscular dysplasia, things like extremely important is obstructive sleep apnea, which is highly underdiagnosed or undertreated. So that's why hypertension is known as a silent killer. It's because it does not have any symptoms associated with it in its initial onset. There are some individuals who either have had hypertension for a long period of time or they have extremely high blood pressures in the 160s and above. For those individuals, they can have some symptoms such as chest pain, headaches, dizziness, or blurry vision. But it's extremely important to see your primary medical provider to be ruled out whether you have hypertension or not, and to also check additional lab work that is necessary. And if you want more information, there's some links in the bio that talks about ways that you can treat hypertension both naturally, and my previous video, which will be linked up here, that talks about the other medical therapies that we can use for hypertension. Well, I hope you found it value with this. If you have, hit the like and subscribe. And to give an overview of this whole video was hypertension is known as the silent killer because it does not have any symptoms on its initial presentation. It's extremely important to see your primary medical provider to be seen, treated, evaluated to prevent the downstream effects such as stroke, heart attack, heart failure, dementia, kidney disease, and many more.